make the announcements.
Okay. Well, I can announce the winner of the audience vote, and that is Click and Push Accessibility, the Atlas app. Thank you, Sydney, for your presentation. It looks like you are the winner.
Wow, thank you very much, everyone. Wow, I don't even know what to say. It means a lot. Like, yeah, to be voted. Oh, thank you, everyone.
Congratulations. I don't know where Sydney's face went there. Oh, they're off in the corner. Congratulations, Sydney. So, we had a tough time discussing things with the judges. There was some back and forth, and it was really close in the end. But the judges have decided that Vibrate is the judge's choice. So the last team that went there, team number 6. So again, I just want to say it was a tough choice. There was some excellent other opportunities ready for commercialization, and there's a lot of great ideas that have a lot of potential. So congratulations, Team Vibrate.
So may I ask if any of the judges want to give any feedback to any of our teams? Now's the time to jump in, because they're all at the beginning, and this is just a stage. We can still improve ideas heading towards the next round, where the demo day has 25,000 in support.
Can I make a comment?
Go ahead, yeah, Jeff.
Hi, it's Jeff Gregson from the Glenrose Rehab Hospital in Edmonton. Just a general comment. I think we see a lot of companies that are trialing products here in the clinical setting, and they're trying to get a kind of a sniff test from OTs and PTs and physicians and so on to maybe identify the line of sight, the more clear line of sight to commercial application. And one of the challenges, I think, is often identifying who is your customer, because some of them are actually going towards a procurement process. And I think, some of the discussion today was related to your clinical trials and how long it might take. And I think the line of sight for the clinical trials and being able to be clear on the methods that you're going to use, and maybe to start that pre-procurement process a little bit earlier if you're going to be selling into the healthcare system. Certainly things like the pressure wound mat, we've seen a number of products related to that. And one of the challenges typically is that you're trying to sell into a large healthcare system, and there's different parameters related to the procurement process. So just want to make that comment.
I think that's a very good comment. Jeff, we find I think that's similar across the country, that actually you need to start thinking about who you're going to sell to before you actually have anything to sell. Because quite often that really does determine where you go and how you develop a product. Judges, feel free. I see you have your hands up. It's all very orderly, but feel free to just jump in at this point.
I want to say thank you to all the participants. It was a great competition. It was very tough for us to decide all the different areas of expertise and judgment that we had. A couple of recommendations that I have many years of experience in medical devices, and there are a couple of things that we oversee. The cost of regulatory and quality systems are big tack when you're trying to define the end user cost, and it's not known at the very beginning. So always look into that, into the accountant. And to add to the previous comment, it is very important to understand the procurement system. In Canada in particular, we have a very cumbersome procurement system. And one have to remind ourselves, we have to remind ourselves that the user is not the payer, and the payer is not the decision maker. So those three things are very important when you're trying to see the path for commercialization. And again, thank you very much. It was a great competition.
Yeah, I would echo as somebody who has worked with some 250 startups in the Health Innovation Hub here. Those last two comments are critical and need to be considered early stage. However, there is no consideration if there's no idea. And the ideas that I've seen here today were very original and creative. And I really want to truly encourage all of you, whether you won here or didn't win, to keep pushing your ideas forward. Pay attention to some of the questions that were asked and some of the advice that was given, and help change Canada towards an innovation economy, and help make the lives of the patients who will benefit from these technologies greater.
Maybe I'll jump in here if that's okay, Joseph and Joanne. John Chernesky here from the Praxis Spinal Cord Institute. We see a lot of fantastic innovations, and I'd like to congratulate all the groups that presented today and the winners as well. I think you guys did a fantastic job. I think one of the things that I've seen in those that succeed and those that struggle to succeed, probably the biggest difference is the engagement that they undertake. Oftentimes we meet up with innovators and new companies, and they're already 10 steps down the road, and they still haven't reached out to the end users of their product. So you need to really consider who is going to be using your product, and start to involve them in the decision-making design of your product very early, whether that's clinicians, whether that's healthcare systems, whether that's people living with health conditions like spinal cord injury. It's very important that you reach out to them very early. Regulatory bodies like the FDA or Health Canada, and really start to plan out who are the users of the knowledge you're generating, and make sure that you bring them along the journey with you. Because the input that they're going to provide you in the refinement of your design and your commercialization strategy cannot be overestimated. Great job, everyone.
Thank you. If there are no other Gina? Is your hand still up?
Yeah, I was still up, sorry.
Okay. So thank you everyone for joining us. To keep to time, please keep being creative, forward your ideas, share. Part of this is developing a community of innovation and ideation. People that have issues, we want to hear about them. People that have contests, we want to hear about them. We're starting to hear already from some of our partners that there are other opportunities coming down the pipeline. Some new and interesting things are about to be introduced at U of A. That there'll be a call coming up. So check out our website, and we are going to do our best to promote opportunities around the country for new ideas and new innovations. And also, please stay tuned. Submit stuff for Demo Day, because along with Praxis, we will have other guests and partners coming in, like Health Innovation Hub, who may be the next organization you work with downstream with your projects as you move towards getting them out to market and having an effect on people's lives. So thank you everyone. For those that joined us, I want to say special thank you to all of the judges that participated. And most of all, I want to say thank you to the Ideation Clinic team, without whom none of this would have happened. And their work and commitment and dedication has been phenomenal. And also a special shout out to our timekeeper, who managed to finish up early. That is a rare thing indeed, Chris. A rare thing. So thank you everyone. I hope you had fun, and see you at our workshop on the 17th. and on June 7th. And if you have any questions, reach out. Thank you, everyone.
Thank you.
Joseph, great job.